A Spanish nurse who helped treat 2 Ebola victims in Madrid has tested positive for the disease herself. Now, this is the first case of Ebola spreading from one person to another outside of West Africa. Mereana Hond has more.
The nurse had been treating 2 Ebola patients at this hospital in Madrid. One of the sick men was Spanish priest Father Miguel Pijares. He was an aid worker in Liberia. In August, the 75-year-old became the first European to die from the Ebola outbreak. The second priest was to die days later. They had contracted the virus in West Africa and been brought to Spain for treatment. Spanish authorities are now investigating how the nurse contracted the virus, given the precautions taken at the hospital and the fact she'd had limited contact with the patients.
Once detected as the Ebola virus, we immediately put into action a series of protocols coordinated by the Ministry of Health. We're working together to give the best care to the patient and provide security for our citizens.
The nurse had reportedly been given the all clear and mixed freely with family and friends for 2 weeks, even taking an overseas holiday before being diagnosed with the virus. But a bacteriology expert says it is highly unlikely the virus will have spread, as she was not displaying any symptoms.
What we do know about Ebola is that you only become infectious when you're actually ill, and particularly when you get into this sort of hemorrhagic phase. And that is the danger time for anybody looking after a patient, not the period between when you're actually infected, when the virus just quietly grows in the person without producing any symptoms. So if you have social contact with somebody who's incubating the disease, the likelihood of catching it is extremely low. It's probably 0.
This Ebola treatment centre in the Liberian capital Monrovia has been operating at full capacity since it opened in late September. The survival rate sits at around 50%, but as quickly as staff discharge patients, they say more keep arriving. The virus has killed almost 3,500 people in West Africa and infected more than 7,000, sobering statistics for a virus that currently has no known cure. Mereana Hond, Al Jazeera.